So you started out with the CDC, and you worked specifically on HIV and AIDS, and you looked at how those two were affecting children
Right.
and their parents. What did you learn from that experience?
You know, I think one of the things that I learned from HIV and AIDS, which then carried on to other jobs, is how important the interaction between society and health is. Because, you know, although HIV and AIDS could impact anyone, no one was immune from getting HIV. It wasn't randomly distributed. It most impacted communities of color. It impacted communities that were marginalized in our society. And I think it really helped me to understand the interaction between societal factors and how diseases are distributed. We now call those the social determinants of health. What are the non-health factors that really influence who gets sick and who doesn't? Who's more likely to be disproportionately impacted than another population? And so often those are societal influences that really make a big difference.
And then you stayed at the CDC, but then you decided, I'm going to go work for CARE, an international agency. I remember when you first came to Atlanta and took over that position, and how much you traveled, particularly to some African nations. Again, what did you learn from your past that was applicable to that role in your career?
Well, I think it was kind of, you know, the continuation of looking at the broad factors that influence people's life outcomes. You know, from CDC, I went to the Gates Foundation first, where we were, again, focused very much on HIV and other infectious diseases. And I think, you know, there I really did come to understand even more the broad factors that influence people's health, but also how the different sectors, the public sector, the private sector, government, all need to work together if we want to have the kinds of outcomes that we want for justice and equity, you know, for people around the world. When I went to CARE, which you know, people often think because I'm a physician and the name is CARE that it's a health organization.
No.
But, you know, it's an international humanitarian organization focused on eliminating extreme poverty. And in my work in HIV globally, I had done a lot of work with women and HIV and AIDS. And it made me appreciate how women's position in society really puts them at risk for HIV. You know, women who were not able to negotiate safer sex because they were not in control of sexual relations with their partners, or women who had to earn money by, you know, providing sex because they had no other economic opportunities. And so I think I came to appreciate women's status around the world and how much it is a barrier to societies moving forward. And that was how, when I came to CARE, we really developed this focus on empowering girls and women, because we recognize that girls and women are disproportionately impacted by poverty around the world, but they're also the greatest hope for changing it. You know, if you invest in a girl and give her an education, she's more likely to marry later, have fewer children, be more in control of her life situation, contribute to the family, have a better relationship with her husband, all of those things that have a huge impact on not just that girl or woman, but that family, the community, and ultimately the nation. And so, you know, we developed this sense that if we invested in girls and women, it was the best way in which we could have an impact on reducing global poverty.